shoulder is composed of groups of muscles from the front and back that keeps it in place, as well as lots of ligaments. That was pretty simple, wasn't it?
Done.
There we go.
Move on.
So, so if I get you to turn around, so I've got muscles in the back of the shoulder, and you probably have heard of rotator cuff muscles. So rotator cuff are the 5 groups of muscles that actually wrap around here, and they'll all come and insert into this region here. And then you've got muscles from the front, your pec major, pec minor, and you got the teres as well that come and insert to this area again. So all of the muscles that support the shoulder, they all insert into this area. One of the reasons that a lot of time people actually feel the pain around here, and sometimes when they feel the pain down here, you may have had it as well, that sometimes people go, no, but the pain's here, is because of the neurological distribution, you get the pain coming down to the side of the shoulder. Why? The reason I'm telling you this is the fact that a lot of times you may not be exercising quite a bit, you may not even get the pain up here, you may not get the pain here, but you might get the pain around here. So if you start getting that kind of pain that happens again and again and again when you're doing repetitive exercises, there is something going on with the shoulder as well, okay? So make sure you bring it to the attention of the coach, so they're going to be able to modify things for you guys as well. The muscles are protecting the shoulder, but structurally you also have got lots of ligaments in that area as well. Ligaments are like very tight ropes that actually hold the bones together as well. Underneath all that, you've got fluid-filled sacs, and those sacs are called bursa. You may have heard of terminology called bursitis. Bursitis is inflammation of the bursa, which is that fluid-filled sac. So rather than being a nice, you have that, yeah. So rather than being a nice cushion that's just going to protect the tendon against the bone, it becomes a hot, boiling pot of water. Think about it like that. So any motion you're going to make, especially past a certain range of motion, is going to give you a lot of pain in that area as well. All right, so 2 things can happen here. You're either going to have a blow to the shoulder, which will take us down a track of either just being bruised or being dislocated. And a lot of times in football, what do? They do a bump like that. And especially if they are not, it can push the shoulder up, which obviously going to affect your AC joint or the shoulder itself, or you're going to do a repetitive activity as well. Typical F45, for example. If your technique's not very good, or if you're going too heavy, or you're not conditioning your shoulder, and hence the shoulder's a bit weak, what's going to happen is that these tendons are going to be able to cope and cope and cope, but after a while they're going to go, I just can't take it anymore. They're going to get hot, they're going to get inflamed, and they're going to become quite painful. When you're sitting in this position, just like this, no problem at all. But what's going to happen is, the moment you want to raise your arm by your side, or you want to go forward, and the moment you're going to get past, usually about 60 to 90 degrees, around this range, that's when you're going to start to feel the pain as well. Why is that? Is because your humerus, which is this bone here, is supposed to be operating in a bit of a gap within that socket. So when you're going to take your arm up, it's supposed to rotate around and be able to come up and nicely go back again. The moment that you've got problem, which is usually an impingement problem, the humerus goes up and whacks into the roof of the shoulder itself as well. So it doesn't have as much gap. So the moment you're going to go up, the moment you get to around 80 or 90 degrees, it's going to whack into the roof of the shoulder, and it starts to irritate the tissues and the nerve and the tendon that passes to that area as well. Or in your case, the bursa itself as well. So because bursa is sitting right underneath protecting the tendons, so if the bursa is inflamed, the gap that exists for the humerus, which is this bone here, is not going to be much at all. So hence it's going to whack into that area and get quite inflamed as well.